First, let's welcome Dr. Ted Parcel of Novant Health Orthopedics and Spine, Brunswick. Dr. Parcel, welcome to the area.
Thank you very much for having me.
It's such a pleasure, and thank you so much for taking time out of your busy day. I know that's asking a lot, but we're real excited to learn about you and about your background. So share some of that information with our viewers.
Sure. I'm from Pennsylvania, and I married a girl from North Carolina is how we wound up down this way.
Of course.
And we had been coming to the beach for many, many years, and we bought a second home down here, and eventually we decided enough of the back and forth and wanted to make the beach our permanent home.
Nice. Well, that's great. So you did marry a North Carolina girl.
I sure did.
Good for you.
It was a great decision.
So I believe you were recently located in the High Point area?
I was working for Wake Forest Baptist there as a joint replacement surgeon, and this opportunity became available, and it was too good to pass up.
Wow, well, we're really happy about that. It sounds like most of your training focused on joint reconstruction. Is that accurate?
Yes. After my residency training, I went down to Tampa, Florida, and did an extra year of hip and knee replacement. And this included some of the very simple, straightforward primary joint replacements, but we also got into some of the very complex reconstructions, infections, fractures. So I've developed that into my practice since I began practice, and I'm more than happy to take care of all those here locally.
There are a lot of hips and knees in this area.
Which is great. With the active older community who want to play golf and be active and outdoors, it's a great population. And I think it'll work very well for me with the community, and I hope I can be a great asset to them. Yeah,
I heard pickleball is really on the uptick here, so you...
Sure, and they'll be very, we'll get to know more about that and all our patients' activities.
Right. I'm curious, is there anything in particular that attracted you to orthopedic care?
I'd always been an athlete as a child, and when some of your favorite athletes get hurt, and you kind of start seeing about how they would get fixed, and my head works more mechanical. I did well with the mechanic side of physics, not the electric side. I was never going to be a cardiologist or neurologist. It was the mechanical side and it makes a lot of sense in that transition into orthopedics.
Yeah, that makes total sense. Well, we are really glad that you chose our area to call home. And I know you married a North Carolina girl. Is there anything else that attracted you to our area?
Getting back down the beach, you know, we had come down so many times with our family, and the kids would get so excited as we would get near, you know, we're here, and they would be all bummed out when we would have to leave. So as a decision for the family, it was the best, and why have to pack up the car on a Friday afternoon and head down this way?
That is sad.
Yes, and then Sunday evening you got to pack up and head back, and it was enough of that. Let's make this full time. And
the weather's so great here, and there's just so much. If you like outdoor activities, that period of time where you can do that is so long here. It's like the growing season's so long.
Sure, more months out of the year to be outside and active, and that's
and it's great for kids.
Right.
It is great for kids.
And my kids love swimming and love the beach, and it was a natural decision.
Yeah. So tell me a little bit about your clinic here in Brunswick County. What types of services or surgeries do you perform?
Sure. Our clinic is located in Supply, around the corner from the old hospital.
Right.
And there will be myself and our two physician's assistants will be in the office. As far as services, we'll do office-based injections and fracture treatment and casting. But my primary interest, as we mentioned earlier, is joint replacement, both hip and knee replacement, from the simple to the complex. I'll be glad to see second opinions, people who have perhaps had something done elsewhere and wanted to have it evaluated. I'd be more than glad to do so.
Awesome, because a lot of people, when they've moved here, they've already had a joint replacement in, say, the Northeast or something, and so sometimes those wear out, I guess.
Yes, and I'm the only surgeon in the area with advanced joint replacement training between Wilmington and South Carolina.
Wonderful. Well, I think you'll be there'll be a lot of folks want to see you, because I have friends that got shoulders and knees and what have you when they were 30, and so they wear out after a while.
Certainly.
Yeah. So where exactly are you located again? You're near
Sure.
the old hospital.
Near the old hospital in Supply, just a few minutes south of the hospital in Bolivia. The office is at 5 Dr. Circle.
Yeah.
Excuse me, 6 Dr. Circle in Suite 5 there.
Great. Well, let's talk a little bit about your general approach to your patients and patient care. How would you describe that?
I'm very casual. I'm not one of these buttoned-up doctors who's going to be, was in the 3-piece suit, looking over his glasses down at his patient as some professorial, not trying, but I'm more casual, get to know them, and I'm blessed with a good memory that I can often just remember my patient's face and their story without having to look through the chart.
Awesome.
And get to know it. I think establishing those relationships goes very far.
Relationships are very important.
Yes.
Yeah, they certainly are. I understand that you offer minimally invasive options for quicker recovery. Is that correct?
Yes. With joint replacements, the day and age of big, long incisions and patients would be scared of all that's involved, we've been able to refine our surgery techniques and rehab protocols to get people moving, and they're in and out of the hospital in a day or so.
Wow, that would be awesome.
So it's been a game changer. Things have really changed over the last several years to allow us to do so.
That's amazing. Yeah. Well, I believe I've seen that patients can call the office or go online to schedule appointments for you.
Yes, they certainly can.
And can you provide the viewers with those details?
Sure. The office phone number is 910-721-4370.
Great. Well, we really appreciate you spending time with us today, and we look forward to having you back. And welcome to the area.
Thanks so much for having me.
You're welcome.